Good morning. I'd like to call the Tuesday, September 8th meeting of the Reno County Commission to order, please. At this point in time, would you stand with me for the Pledge of Allegiance? I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Commissioner Bob Bush is not with us today. I believe he is in Kansas City for some medical treatment. Not sure that I have any other announcements at this time. I'll read the rest of my comments for commission comments at the bottom. At this point in time, we have an update from our health officer, Karen Hammersmith, and emergency management director, Adam Weishire. They just entered the room, so please join us. Good morning, Karen.
Good morning. We're on our call late this morning. And then my computer's froze up. Do you want Adam to go first? Why my computer?
Sure. Adam, it's seldom that you get to go first. You take advantage of your presentation this morning.
I'll be quick for you this morning.
I don't know. She might need a couple minutes to really do that.
Good morning. Adam Weishire, Emergency Management Director. It'll just be a typical update for me this morning. This is day 192 of COVID for us. We started on March 1st of 2020, and the Board of County Commissioners declared a public health emergency on March 19th. That has been extended until December 31st of 2020. Currently, we're one of 103 counties that have an active disaster declaration in place. Morris and Barber County do not have current declarations, but I could see them signing new ones in the near future. There's 105 counties in Kansas with active cases. KDHE reports 181 outbreaks. That's an additional 14 outbreaks since the 2nd of September. Long-term care facilities have 53 outbreaks. Schools have 3 outbreaks, and sports have 7 outbreaks. I can break out all those for you if you wish, but those are, I think, the 3 highlights we're really looking at in Reno County. KDAD's, the Kansas Department of Aging and Disability Services, they talked last week about House Bill 2016 and some funding that brought some testing machines to facilities in Reno County. And to date, there's been 6 long-term care facilities that have received COVID-style testing machines in Reno County. Those are Good Samaritan, Prairie Sunset Home, Diversicare, the one at 2301 North Severance, Mennonite Friendship Communities, and then Bueller Sunshine Home. The quarantine guidelines that we talked about last week have not changed, where if you travel out of state to a venue of 500 or more, you will have to quarantine in place. And then I also want to touch again on the governor's disaster declaration that is set to expire on the 15th. We have been told she's working on that declaration, but it's really going to have to go to the legislators to know if she still has powers after September 15th. So currently, all the executive orders associated with that disaster declaration are set to expire, including the mask mandate 2052, Executive Order 2052. Still, there's 11 jurisdictions that are following that order, 11 jurisdictions that have a specific county order, 66 jurisdictions that have not adopted a specific mask order, and then 13 counties who have not reported. One thing I want to touch on was Dr. Fauci last week talked about we need to cut cases by at least 30,000 to avoid a disastrous flu season. And if you look at cases right now, they're right around 40,000 per day. That's all I have for you this morning. You have any questions?
You went through the case numbers pretty quickly. Would you go over those again?
So the Kansas Health and Environment reports a total case count of 46,914 positive cases of COVID-19. So that's cases in Kansas. 485 of those are resulting in death, and then 181 outbreaks with that 181 outbreaks is 5,177 cases, 204 hospitalizations, and 73 deaths.
And you said something about sports outbreaks. Would you cover that again?
So sports outbreaks, there's 7 outbreaks across Kansas with 71 cases, 0 hospitalizations, and 0 deaths.
But you specifically said something regarding athletics. I want you to repeat that.
So that would be the sports outbreak. So there's seven outbreaks related to sports
Within Kansas?
within Kansas.
Okay. Okay, any questions?
I've got a definition help on this. Now, you or Karen can help me. What defines a cluster? I see clusters come up quite often. Is that 2?
I think. Go ahead.
So I
mean,
could explain
I
that
don't-
for you, but I think it's better coming from our health
Okay.
officer, so I'll turn it over to her.
You can answer that whenever you want to. But, that was just, I see those and I didn't.
So yeah, a cluster is only defined as 2 people. So 2 people that do not live in the same household that are connected to a case. So if you are co-workers or if you're on the same sports team and they can connect that you have it about the same time period and that type of thing, and you've been in close contact, then that would be a cluster. But if it would be family members living in the same home, they don't consider that a cluster.
Okay. So it's 2 or more that
Are connected.
Are connected, but not
Outside
in the
of
same household.
Outside of a household, yes.
Okay. Thank
So,
you.
just going over the metrics from last night. Prior week of positive test rate of 5.48%. We had a 7-day average positive test rate from 9/1, and that was 9.6%. Community positive test rate is 7.28%. We've tested 7,212. We have 809 positives, 6,406 negatives, 135 active cases, 6 clusters, 1 fatality, and a positive test rate of 11.21%. That would include the prison population. We've tested 11.48% of our population, and we've recovered 673. We should actually, probably those metrics will change a little bit more today with the long holiday. It's a manual process to get those active cases off of there. So as our epidemiologists are calling patients and making sure they're feeling well, that active case count will probably come down quite a bit today. We did do the testing. You guys are allowed us to use some of the funding for testing. So the Hutch Clinic utilized that on Saturday morning, and they tested right at around 250 people. Those were employees that got an email blast from Bueller and Hutchinson school districts. They included teachers, staff, and spouses to come if they would on Saturday morning from 9 to 11:30 to get tested. And so we did that as very successful as far as getting people in and out and getting the test sent in. So we really much appreciate that in community testing, and we'll wait to see kind of how that comes out. Either way, we're either going to get more people tested in our community, which then we can have a bigger picture of what's going on. The other thing, well, if they do have more positive cases that are asymptomatic, we'll be able to dial down on them and hopefully get them isolated so that we wouldn't have more cases from them. So that needs to be a continual thing so that we can get our population tested on a regular basis. And then the same thing, if there are other pockets, we could, squelch those and make sure that we're helping out within the community. And we'd like to continue to use some funds until we get secure the other funds from the grant that Megan will talk about, I think, a little bit. Nope, she wasn't talking about that. I don't think she knows anything about that either yet. But we have put in for money for a specific grant to do more community testing. Just going to let you know, too, that the medical team that we're working with the schools would be Dr. Pauly, DJ Gearing, who's our analyst, and then myself. We meet to review the data. We send preliminary results to the school superintendents here, and then on Friday mornings we meet with them, and then they'll use the gating criteria to move into the zone for the next week. on the gating criteria. Each individual district has their different sets of how they're going to use those zones, because everybody works a little differently. Obviously, it works a little differently in Fairfield than it would at Hutch High. So their remote learning or changing to block schedules to navigate that is just a little bit different. But they will send that out to their districts by 11:30 on Friday morning, so that everybody will know where they're going to be at for the following week. It does not affect anything that's happening that night or that weekend as far as activities. Let's see, I talked about that. The other thing I really wanted to stress is social distancing as well for businesses. And I don't know, just so that everybody has a good idea, that people really do need to stay 6 feet apart from each other. If you're within a coworker in school settings or just in your own businesses, that 6 feet in 10 minutes can wipe out a business. So if you have a small business and your entire staff goes down, that's what closes your business, because you don't have anybody that continue to work. Now, we don't necessarily close you down and say you can't keep your doors open, but if you don't have staff there, I mean, that's what's going to happen. But I continually see that when we're calling people, that they just don't realize that 6 feet and 10 minutes is really an exposure. And to eliminate those exposures and to eliminate people from coming down with it, that's what we do to quarantine people. So I just wanted to kind of really review that and push that, as well as washing hands, wearing the mask. All of those things really help. Any questions for me?
Yeah, Karen, would you go back? You read them pretty fast. You gave 3 percentage rates. Would you again state what those different percentages are on testing?
Okay, so the prior week positive test rate was 5.48%. 7-day average positive test rate, and that goes from 9.1. And our community positive test rate, that would be without the inmates, was at 7.28%.
Okay, so help me. My memory is that these numbers are somewhat lower than numbers that you have given us in the past. Is that correct?
I believe so, yes. And I did talk to DJ last night. We were emailing back and forth to just clarify, because I think the prior week positive test rate of 5.48% is a little bit lower, but he also believes that should be going up a little bit higher as well. So I think that will be adjusted as more data comes in.
Okay. Commissioner Hurst, do you have questions?
I think there is some confusion out there when it comes to these numbers, because people see that 11.8 and they don't realize that includes the
inmates.
Reformatory, as I call it, or the correctional institute. And so I think that definitely needs to be somehow transmitted, that we're talking about our community rather than the community of the correctional institute. I think there's two different communities.
I'll look how we're labeling that. That's why we put the community on there, so that would be in our community. That's how we were thinking it. But if we could label it a little bit differently, that might be beneficial for everyone. It's a good suggestion.
But I do think that those numbers are better and showing some progress, or maybe it's just that we don't know what's going to happen with this 40-degree weather change. That I'm sure we're going to see a lot more coals come out of this, and that those are separated out from the COVID.
Yeah. So we move forward to flu season. That is our concerns. But we do have a lot of immunizations available, and we'll be giving those, and we're also going out to companies to give the flu shots as well. And I know that the other community areas in town, Walgreens, Walmart, Dillon's, they're all kind of already advertising that they have their flu shots in. So we do really want everybody to get a flu shot.
So I think any others will be later on.
Okay.
All right, thanks.
We please stay, because we're going to attend to this continuation of the testing early on in the
Sure.
agenda here.
Okay.
Okay, if no other questions on the COVID-19 at this point, we'll move on to public comments, not on items not on the agenda today. Looks like we might have a couple people in the audience that want to make comments. If so, please come to the podium, state your name, address, and present your comments. No one? Okay. We'll move on and determine additions or revisions to the agenda. Commissioner Hurst, I'd like to recommend that we move the consideration of the proposal from Hutchinson Clinic for asymptomatic testing up to be item 6A, or right after our motion to approve the agenda. And that's the only item that I would like to put in, please. Do you have items that you'd like to put on the
No, sir.
agenda?
No, sir, the notes are already on there.
Okay, so I guess we need a...
I'll move to add the agenda, or move up the agenda for, no, it would be an addition.
It would be an addition.
Should be an addition agenda to talk about the proposal from Hutch Clinic.
Okay, I would second that. Please call the roll.
Commissioner Hurst,
Yes.
Commissioner Sellers,
Yes. Motion carries, so agenda is as amended. Randy, would you introduce this, please, and then we'll ask Karen to provide any information she'd like to on this item that came up last week that actually started on Saturday.
Okay. The Hutchinson Clinic had reached out to the county about working on an initiative to do asymptomatic testing for residents of Reno County. And with this, their proposal was to do about 250 tests of Reno County residents per week, with maybe some emphasis to begin with on school district staff, employees, and their partners. And then the projected cost per week is $29,725. Projected cost per month, $118,900. That would come out of CARES Act money. Reno County's $12.6 million was approved, for the most part, kind of preliminarily approved last week of what the application the county commission voted on, sent to the state a couple weeks ago. We could reallocate some of that money. There's some for testing in there. There's also the Reno County probably has money to cover this amount, this monthly amount or a weekly amount, whichever the county commission would like to go with, if any. Last week, the county commission in conversations was okay with doing at least 1 week, which began Saturday. That was Friday evening that it was okayed, and then Saturday morning, as Karen mentioned, the testing began. So the Hutch Clinic's proposal is to see, I think, if Reno County wants to continue this, and so it would be probably best for the county commission to make a decision or give direction of whether to continue past the week that has already taken place and how far to go with this. Knowing we can get the CARES Act money to cover this, but it would take away from other projects or reimbursements.
Okay. Karen, would you like to address, if you know, they did 250 tests on Saturday. These are people that show no signs of having the virus, correct?
That was the goal. Now, I personally was there and helped screen quite a few people. So if somebody had allergy-type symptoms, I know we went ahead and tested them. I personally didn't have anybody that was a fever, but I don't think they refused anybody. The goal was to have people that have not been exposed, that have not traveled out of state to a gathering of more than 500 people, and that were not showing any symptoms, so that you get actual community testing, because that's a screening. Otherwise, you go into a diagnostic test. And so, we weren't there to treat people that were ill. It was just a screening process.
Sure. Okay, and for those listening, and maybe also for my information and Commissioner Hurst at this point, is up to now that testing, by and large, that's been done within Reno County is people that have some symptoms, whether it turns out to be the virus or something else. And the reason that I understand to do this is if we test those that don't have symptoms, we have a better understanding of spread within the community to know what part of the school chart that the schools are on, or whether they can be fully open, partially open, or closed. Is that correct? I'm thinking in my mind of a green, yellow, and red school chart that's been approved by most of our school districts.
Yes, I think you have a pretty good understanding of it. The testing so far, has went through a couple different phases depending on where we have been at with this whole process. So when we started testing, they just ran out of supplies. I think they couldn't get supplies early on because everything had been eaten up by the East Coast and West Coast. But by the time it hit here, we were able to test a few more patients. But they have primarily targeted patients with symptoms or direct contacts of people that have had symptoms. So until now, we have moved into the screening phase. So yes, to your point, we have not focused on just a screening process to see what is out in our community.
Okay, and would you agree with my statement that in yours and the clinic's opinion, and I believe that this has been discussed by some school boards, that this total testing needs to be done to know where we are on that chart that the school boards have adopted?
Yeah, to have an accurate positive test rate, then you cannot just target your people that have symptoms, because otherwise that positive test rate could be 100%. If you're only testing somebody that has all the signs and symptoms that it's COVID, well, then you're really looking that's what you're going to find out. So that gives you a positive test rate. It doesn't necessarily let you know what is out in the community. This also affects our nursing homes because they're in the same criteria from CMS with a positive test rate, that they then have to keep their nursing homes closed down and do more testing on all of their staff, and then their residents as well.
Okay, and if the mind of the commission was to approve this for a period of time, the clinic is telling you that they have the necessary supplies for a period of time to do this on an ongoing basis each week?
They have looked at just the proposal for a month, because then we would like to secure funding and then move this out more towards the community, so that we can get in populations that have not been able to be tested specifically.
Okay. So as you understand the clinic's proposal that you have discussed with them, they would like us to just, if we see it as positive, to propose it for just a month.
Yeah, that was the proposal.
Okay.
Mm-hmm.
Okay, Commissioner Hurst, do you have questions?
Yes, could you explain, and I was going to bring it up and later on, but would you explain what Commissioner Sellers said, the green, red, and yellow?
So
I didn't, when I got a call Friday afternoon,
mm-hmm.
I had no knowledge. And to make a decision, spending taxpayers' money without the knowledge, I was a little got, okay?
So the gating criteria came out from KDHE and Kansas Department of Education, and had a positive test rate of less than 5, less than 10, less than 15, and less than 20. And it goes into a green, yellow, orange, and red category. And then under that, you could outline exactly what districts would do as far as your online virtual or hybrid mode, and then like no activity. And so all of our superintendents, as well as this medical team, have looked at this gating criteria and to see what it is. We're also looking at the other metrics in town, looking at our hospital. We don't want to overwhelm our hospital as well. So the first time that we're looking at it, our positive test rate is elevated, and we had 53 patients in our hospital, and we did not have anyone in ICU at the time. So that the metrics were not adding up. I mean, it's a gut feeling when you're looking at those, but that's why we really got in and looked at our gating criteria and saying, you know, we need to do different things. We need to look at this differently. And so looking at that positive test rate, and that's why we really kind of flipped our thought process from just testing symptomatic patients to doing community testing. We knew before, the first reason we wanted to do community testing, which was our emergency management was really pushing that, was to know if we had COVID in the community and it just wasn't being, you know, looked at or diagnosed. Well, after we knew that we had community transmission, as far as a clinician, you're not necessarily looking for that anymore. But this is more of a different model of like, okay, we've never been in a pandemic before, so we haven't had to think of those types of things. We don't test for things in other realms or haven't in our careers as far as finding out, do we have more in our community? If we have it coming into the facilities, you know it's in a community, and you just do surveillance. Well, we're not with surveillance yet with COVID-19. So we have flipped our whole thought process that we do have to do community testing, and we do have to test asymptomatic patients, which is not something the medical community has ever really thought about unless you're in research. So that's where it has come from, because the gating that KDHE and the Kansas Department of Education didn't match up with what we were looking at. So that's why we have had this, and that's where that came from.
Okay. Well, I know that some school boards weren't really contacted much to explain the whole process on this. And
I think the superintendents were looking at that, and we're looking at it as a guide, and then the superintendents are pushing it out to each district depending on how they work with their own Board of Educations with that.
yeah, but it hadn't occurred yet Friday afternoon to speak of at all. And I think the school boards have should have quite a bit of say in how this process works. They should be informed, and that concerned me a little bit, is the fact that we vote on school boards to operate the schools, and I think they should be contacted and at least know what's going on.
Okay,
And
well,
I
Commissioner
don't think
Hurst,
the
I would.
communication was very well. And
Well-
I'm not trying to make an argument, but what I'm trying to say is we need to have full communication.
Okay, when I was contacted about this, I contacted a board member of the Bueller school system, Commissioner Hurst, and their indication to me was that the Bueller School Board had discussed this process and was in full agreement with this process because, again, they were using the green, yellow, orange, and red approach towards this. And if we can test the community as a whole, which is what's being suggested here, that we did Saturday and continue with it, and show a lower rate of total community spread, would that be the correct deal? We've got a better chance of keeping schools on that chart in the green or marginal area instead of a shutdown. And as you and I have talked in the past at these commission meetings, is I think you and I totally agree we need to do whatever we can to keep schools open, to keep people at school. And I see this as a method of helping us see the real percentage within the community so that the school boards know where they're at in their process. And again, my understanding, I was told Friday afternoon that Bueller School Board had discussed this process in detail and was very favorable. That person indicated that 308 had discussed it and was favorable to this. I did not talk to a 308 board member. But it makes sense to me that by doing this and reallocating not our taxpayer funds but our COVID funds to doing this, we're much more likely to keep schools in attendance processes as much as possible. And that's not worded very well.
Got your meeting.
What?
I got your
You
meeting anyway.
I think this doesn't have anything to do with whether we approve it or not, but maybe it does, because as I understand it, an email went out to teachers and administrators of 308 and Bueller's 313. I never get that number. Friday night, and they had 250 people show up to try to keep schools open. I think that's meaningful. On a Saturday morning, a non-school day, these people were in cars lined up to get this testing to try to make us have a scientific approach towards the real spread within our community.
And I would say that's an
And
accurate.
so I would very much support this just for a month, with last Saturday being the first deal. And I would think after 2 or 3 weeks, we could discuss it again to see if we want to continue it.
Yeah, that was my thought too. I'd like to see the test results back from this and to revisit it next week.
Sure.
And,
And the feeling was that they're going to get these in 2 or 3 days, correct?
Yeah, I think we should have them back today or tomorrow.
and how many will you have to test to bring this 7.28% down?
Well,
If it stays at 7.28, okay?
the goal is to test 3.6% of our population.
How much?
3.6% of our population
Through the
for a month.
community?
Yes, to get a community view. And so, and then that would be a continual basis. So if we do around 250, then that gets us a little over 1,200 patients a month with the other things that are going on in the community with the testing. And so that goal is to continuously do that on a weekly basis.
And I understand that the health department is looking at doing this also. Is that what I understood from the phone conversation?
We would be looking to do that with the grant that we put in for, that we will not know of that security until later this week.
Until when?
Later this week is what I'm hoping.
Later this week?
Yeah.
Well, I'd like to see this on a week by week. I understand you're wanting to get as many out there as you can so you can bring this number down. We're in a pretty good shape right now. If you take 7.28% of those that have symptoms that are testing positive, right?
Well, but it has elevated a little bit. So we do need to do more testing.
9.6 is what do you, because I got 5.48.
And that was for last week.
That was for last week.
But I do believe that will elevate this week.
And 9.6% was, here again, you went through this once, but
That's fine.
Yeah. And I would have to go look at my computer
Yeah.
again, as I don't want to quote on something that I don't have in my mind, because I look at those every single day and they fluctuate just a little bit.
And Ron, I think if I understand the charts that the Kansas Department of Education has sent out that many of our school boards are following, the idea place to be as open as possible is to get this number under 5%.
That's correct.
And as I think I understand it, if we can spend and do some additional testing to get it under 5% and on a science basis,
good category.
then we're helping our schools. And I'm sitting here today to say that the county needs to do whatever we can to help our schools be in business.
Yeah, we cannot afford to have kids miss school and try to put 6 or 7 hours on the computer at home, which they probably won't do unless they're really, and it's a challenge for parents to get that done. It's a whole different atmosphere with the mom or dad there and versus the teacher. And from the last results that I heard, I can't verify these because I haven't checked on the verification, but about 26% of the students in the U.S. are having some type of stress with regarding not having school. Mm-hmm. And that has to enter into it. I know we very seldom talk about mental stress when we talk about COVID, and that needs to be taken into account. I'm more serious about that than I am the actual virus itself for that age group. And maybe I'm seeing it wrong, but
No. If you've worked with students, if you're in the healthcare field, if you're in education, you're always concerned about mental health, and this has been a challenge for not only their teachers, supervisors, administration, as well as all people looking at that mental health, because it is a huge issue.
And Commissioner Hurst, I would expand that if we would have to close schools because of too high a test numbers, then we have a job problem of parents that have to stay home from work to be with students. And so it's twofold or multifold problem that makes it as critical as possible for us as county officials to keep schools in session.
Yeah.
And so, I think that I understand your weekly deal, but I really think that if we can afford to do this with COVID money for at least a month, that will give us an indication of whether this is science numbers, which you're always asked for, of whether it's really given. I'm just afraid if we just do it week by week, that's not a long enough period to understand the science of this thing.
And that's why I was asking about how many numbers it would take to offset the figures that we're getting from the people that actually show symptoms.
Well, we don't want to just offset, though. I think we don't want to just assume that we're trying to water this down. We're trying to get an accurate picture of what's going on in the community. Because, if you go out there and we tested the school, the students, instead of, the teachers, and you have a lot of kids that are asymptomatic, then we have just narrowed down that we've got a bigger problem in our community. And we want to know what is going on in our community specifically, because what really drove this is that the numbers weren't matching what our hospital had either. Mm-hmm. So that's where we wanted to get that community testing. The other thing with funding it for the month is just the whole planning process. I have no problem coming in saying, okay, how did this go this past week and so on and so forth. But we had 3 physicians I know were volunteering their time because they get paid differently. They're not on, they're salaried, obviously. So we had 3 physicians there for 2.5 hours on a holiday weekend. These guys have kids in school. This is their community. They're treating these patients. They're seeing them in the hospital. They've got a lot in this game too, and so they were there, in a short notice. And I think we have just this community on board, and we need to move forward with that.
So that's what it costs, $100 to get a test done, $118.
Mm-hmm.
$118.90, excuse me. That was interesting. That's good knowledge for me. Yeah, I would, I know you're passionate about this. and Commissioner Sellers. And I would go along with this, providing we look at it, and if we see, if you get the opportunity then to get your grant, that you figured out how to make this thing work with your staff
Yeah, that
and
would
so
be the
forth.
plan.
Okay, with that statement, I would move that we approve the proposal from the clinic to do this on a 4-week basis, per their proposal, with this item to come back on our agenda in 3 weeks to know exactly where we're moving to at that point in time, and whether to move towards a county testing or to continue with this at that point in time.
Chairman, can I make just a couple comments?
Sure. Wait, is there a second to that motion?
I'll second for
If
discussion.
I don't do that, Adam, he's going to interrupt you anyway. So, Adam, do you have comments?
Yeah, I have just a couple comments for you. So we started looking at community testing all the way back in March. So this isn't a new concept or anything like that. Once you get into schools, the NEA, the Kansas National Education Association, put out those gating standards approximately a month ago. From that, Reno County has done their own standards, and then each school district has done standards based off of those as well. So that's kind of where these standards come into play. My only concern with the clinic testing at all, the clinic's telling us we have swabs, we have supplies to do it for X amount of time. But I can tell you every single week the clinic is requesting swabs from us, saying that they can't keep up with the current demand they have. So just this past week, they put in a request to the county to provide them 1,000 swabs. Are they stockpiling? Do they not have them? I don't have any idea. They could have them. But seeing all the resource requests come in, we are still giving them supplies on a weekly basis. And that's the swabs they're using. I know the county is looking to do our own testing pretty quickly. It's something that we've been waiting on grant dollars for several months. But if there's CARES funding available that we can push that out now, I think we could have a pretty quick turnaround on that, where the county can start doing some of that testing. Not only would it be there'd be a cost savings in that as well, but we'd also try to not just hit the businesses, not try to hit, but hit a lot of the underserved population that haven't been able to get testing prior to this point. I do think it's something we need in our community. We've been pushing for it a long time, and we're here. I think the clinic stepped up, and they're doing great things for our community, and I think that needs to continue at least for a little bit. But I would just caution you, I'm not sure that they have the supplies, and I would like to see it more of the county staff, or doing it in-house versus pushing everything out to the clinic.
So that would basically, I think we fully understand that it would be contingent upon supplies, don't you think?
Mhm.
So if they don't
Yes,
have supplies, they can't.
And I'd like an update next week on yours and their understanding of where these supplies are.
I got one other question that probably concerns Karen, maybe you. There is, I understand from reading the paper that this is an esophageal. I'm not probably saying that correctly, but it's a different swab than the nasal swab. What's the difference? What's the accuracy? What do you know about it?
So they're following what the CDC guidelines have said, and they went with the nasopharyngeal swab for most of the beginning part of that, because that is what was the gold standard. Now the CDC has come out and said you can do an oral pharyngeal swab, which is a little bit more palliative than that nasopharyngeal swab, but the same accuracy, is from what I understand.
Same accuracy?
Mm-hmm. Yeah.
Okay, now, when you do 250, was that just first come, first serve?
Yeah, there was not appointment time, so they
Yeah.
just got in a line and drove
Okay.
on through. Mm-hmm.
So it will be available to anybody?
Yes, they just had to do an email blast out to get a certain amount of
First
people
start.
there. Yeah.
So how do you perceive that the next week's 250 will be done? Will they announce times that people can come out and do this? How do you perceive that will be done in the future?
So we had no time to advertise before,
understand.
and now we would have to do that. Now the superintendents have volunteered staff, and then I also think that we could go to other businesses, or we could just open it up to the community. It doesn't matter who actually gets the test, as long as we can get 250 community members there.
Okay, so will you work with the clinic, please, to make this known to the community who we want to have this coming week and
Sure.
make sure it happens? Okay. Is there anybody else in the audience who wants to speak to this issue before we vote? Not?
Well, yeah.
Gentlemen, please come to the
Jeff.
podium, state your name and address and your
My name is
thoughts.
Doug. My name is Doug Smith from Arlington. I was talking to Karen about the community that they are represented, because I kept hearing Bueller and Hutch, but I never mentioned anything farther out west, like the Fairfield School District. And I was curious about whether or not they're going to be doing any testing out there, or are they still going to be having, because right now we're at a point where we need to find out whether they're going to still do remote learning, because we're providing internet for the kids in our community. And that'd be helpful if we had some more information, if they're going to be posting anything online about where they are in this COVID, as well as to the school district. And that'd help me out a lot, where I can inform the board about what's going on.
And I was told, and whether this is accurate or not, you can conclude that the testing was basically Hutch and Bueller because they were easy access to the testing. Now, we're all a mobile society, so 20 minutes is not much different than going from the west edge of Bueller School District to
No, it's
cover the rest.
It's because they have the highest amount of employees at their disposal, and it was on that side of town. It was really just the short turnaround time that we had to target those areas. Fairfield superintendent has been at all of the superintendent meetings as well, so she has been there, as well as Pretty Prairies.
Yeah, and this is what I'm talking about. Some of the boards didn't know. So that's communication. So you might make an extra effort to inform and have some questions and answers for the other school boards so they know what's going on too.
Okay.
Okay. There's no more discussion on this. I'll call for the question, please.
Commissioners.
Yes.
Commissioner Sellers.
Yes. Okay, thank you. Moving on, we'll go to the consent agenda. Items A and B. A is vouchers in the amount of $368,484.20. Item B is change orders from the appraisal department for 2020 of several change orders there. Is there a motion to approve the consent agenda?
Approve the consent agenda as presented by staff.
I will second that. Is there any discussion of any of these items? If not, please call the roll.
Commissioner Hurst.
Yes.
Commissioner Sellers.
Yes. Okay, at this point in time, we'll have an agency update from Startup Hutch by Jackson Swear. Startup Hutch is one of the agencies that is funded partially by the county money. So we wanted to have quarterly or updates by what is going on at Startup Hutch. Jackson?
Yeah, which here I'll take. Does this make it go? It should.
Oh.
Maybe.
We get to look instead of read.
If not, I'll have to just say next slide. That'll work. Good morning, Jackson Swear, Entrepreneur Navigator Startup Hutch. You can hit the next one.
Here I go. Jackson.
Oh, does it work now?
It's hard on that.
Oh, of course, turn it on. That's the trick. All right. Thank you all for inviting me again today. I know when I came a little ways back, when we were talking about budget season, you indicated a desire to get some regular updates about Startup Hutch. And so I hope to continue to be able to do that. And so I'm Jackson Swear. I'm the new, as of about 5 months ago, Entrepreneur Navigator and Director at Startup Hutch. And We've been working on a new branding and a new marketing effort to get the word out about our organization and the work and the action plan of our entrepreneurship task force. So I'm going to give a little bit of an update about that. But first, as we can tell, since we spent the first 50 minutes of the meeting talking about COVID, I thought I would spend a little bit more time talking about COVID-19 and how we've been involved in some of the response to that. So one of our most significant things that we did internally was to work with the current borrowers that we have to offer them deferrals on their payments so they could stay in good shape on their loans. And we did have about half of our loan portfolio accept deferrals, but most people were able to continue to make payments, which I think is a good sign for the strength of the economy. Of course, many are struggling, but most are able to keep up with things like their loan payments. We've also been involved in the Reno County Economic Recovery Task Force. I think I've got 2 task forces with my acronym there. And that has been important to getting the word out to local small businesses and entrepreneurs about what's been happening. That was very active a few months ago, but continues to sprinkle in every now and again. Startup Hutch was involved with a couple of different loans in partnership with Network Kansas, the higher loans for the hospitality industry and the Restart Kansas loans, which were made available through some tax credits purchased by Reno County businesses and financial institutions. Altogether, between those, there are about 7 loans to local businesses that help them with operational capital to stay open or to reopen during the pandemic. We've helped some folks get access to PPP and EIDL money, although mostly that's been going on through people's banks. We're just a signpost to direct people to where they need to go. And we've been involved with helping the city to process its applications for the CDBG CV grants and spreading the words about those for the city and the county. Most recently, Startup Hutch, primarily through Dave Ducart, our other employee, has been involved with processing the applications for Spark funding in our region. That's another partnership with Network Kansas, who is helping the Department of Commerce to administer those funds. I understand he's looked at many applications from Reno County and other South Central Kansas businesses. So that's just a little bit about what we've been able to do to help bring some funds into the community to help people stay open during the pandemic. Now to the more fun parts. So we've made some good progress on our new emerging mission. Again, this is year 1 of a 5-year action plan, so we're just getting started. As you know, I started at Startup Hutch just about 5 months ago, and one of my first priorities, in addition to getting the new branding launched, was to review some of our existing processes and look for ways to improve some of how we serve entrepreneurs. That's led to a few subtle changes that I hope will see some benefit in the future, like freshening up our loan application and clarifying some of our process to get funds from us. And we've also been working to update our systems for tracking people who are coming in through the door. And we've also continued to work with the Entrepreneurship Task Force to develop measurement tools and to continue to update our plan for what we're going to do over the course of the next 4 or 5 years. I've been encouraged to see some people filling in our pipeline of projects and loans, and just in general seeing some clients coming in the door. I think that in the next 6 to 12 months, as we start to emerge from the other side of the pandemic, we'll see a lot more activity on this front as well. Since I started keeping track myself when I started, I've seen about 19 new clients, over half of which are in the category of having new businesses that they want to start. So even though we're in this period of economic struggle, there's high levels of unemployment, one of the things that drives is people wanting to be more entrepreneurial. So I think that that's a silver lining perhaps. We've also been able to make some progress in beginning to build out this network of entrepreneurs and resource providers and existing small businesses. That's the core part of the new mission for the organization. So we've done this in a few different ways. We have built a new online community that includes a Facebook page, a new website that's seeing continuous updates, and a private Facebook group called the Startup Hutch Idea Exchange. I've been very pleased with the community's response to both our private group, which is an opportunity for entrepreneurs to talk amongst themselves and to share ideas, and also to our Facebook page, where we've been hosting some virtual events and getting the word out about resources that are available to entrepreneurs. We have nearly 500 followers on the Facebook page and almost 150 members of the Facebook group. So I've been pretty excited to see the community adopt that. And this is the part in the meeting where, for the benefit of the public, I'm supposed to shamelessly plug the Facebook page and encourage everyone to go like and follow us so that you can see what we have on offer for the community. We've been doing some new experiments in the events and meetup space, mostly including some virtual offerings. You can see featured here the hot seat with Jackson Meat featuring Jenny Bryan. We've had a couple of in-person events as well. Those have really struggled for attendance. I'm blaming the pandemic for that. We had a much better turnout for some of our events back in 2019 when the task force was running them. I think that there is a real hesitance among many people to get out. But the flip side of that is that some of our virtual offerings have been extremely well attended. We've had as many as 20 to 30 people tuning in live, and the most recent hot seat with Jenny Bryan was very popular. I think it has almost 500 views on Facebook. So one of the advantages of content like that is that it's still around and people can catch it later, even if they don't catch it when it's happening live. We're also starting to build up a portfolio of success stories of local entrepreneurs. There are a couple of different purposes for that. The first is to inspire others to feel as though they can become entrepreneurs themselves, to share some of those stories, and to recapture this image and thought of Reno County as a place where there are lots of entrepreneurs. I think as the more I get into this work, the more I realize that there are many successful entrepreneurs in this community, and that we do have a strong entrepreneurship ecosystem that we can foster and make better and create more jobs through new small businesses and expanding our existing small businesses. And the other thing that the success stories serve to do is to build opportunities for people to make connections to these entrepreneurs. So featured here is Holly from Holly's Sweet Treats, who might be able to help you with a commercial kitchen, for example, because that's something that she knows about. So we're trying to find entrepreneurs in different areas who have been successful and share some of their stories. And then maybe if someone wants to start something new on their own, they'll have a peer that they could reach out to that might be in a related field or industry. Another project that we're working on that's in progress that I wanted to share with you is our effort to create a video library of resources with local people telling their stories about what you need to do in order to start a business successfully. These are kind of some stock photos. It's trying to show you the sort of thing that we're going to do here. The idea is to create evergreen content so it works all the time going forward into the future, and that answers kind of the top questions that people ask so that people can get their questions answered online. These will live on our social media and on our website. So, and of course, although you all, I think, know this, I just wanted to make sure to add that we still provide the resources that formerly the Quest Center, now Startup Hutch, has been providing for the past several years, many more than several years. We offer business coaching for people who want to start businesses, and for people who need a little bit of help tightening up their business plan, maybe to make an expansion, or maybe they're struggling a little bit, they need a little bit of help to keep things afloat. We help people make connections to different resources outside of what we have. We provide training opportunities, many of which are in partnership with Network Kansas. Destination Boot Camp is a very popular one of these, and we've recently had 6 new folks go through Destination Boot Camp, and we're going to do some additional training with those folks with John Schallert, who runs that program. That's a world-class program for retail marketing, for creating a destination out of your business. And as always, we provide gap financing in the form of loans to businesses who need a little bit of extra money that they can't get from the bank. to get their business started. And in some cases, if the business plan is strong, we can even provide some financing without the involvement of a bank, particularly for smaller things to get people going. Just want to close with a reminder to myself and to everyone in the community and to the county commission that this is all a bit of an experiment. Again, this is year 1 of 5 years of an action plan that's built around trying new things and working to improve our community incrementally in small steps. And that means not being afraid to try things that don't work. I don't like this word fail. Nothing ever fails if you learn something from it. So things like a couple of our in-person meetups maybe weren't as successful as I'd liked. Maybe we can learn a little bit about that and lean into some of our virtual offerings and circle back to some in-person things when we can get outside next spring or when the pandemic has finally passed us. But altogether, I just want to encourage the community to try new experiments, and that this extends into entrepreneurial activity as well. You know, we need to try different things and jump out there, give it a shot, and see what works. With a little bit of planning and a little bit of willingness to try something new, I think we can create great things. So that's what I've got. I've got my info up here. Again, make sure to like the Facebook page and reach out to me through our website, or my email's up here. We've got a little bit of a formatting issue with my slide here, but it is jackson@startuphutch.com is my email if you want to reach out to me. So I tried to be quick. I know you got a full agenda. Any questions for me?
Commissioner Hurst, do you have some background in this work? You have any comments to Jackson at this point?
Good job on what you're doing. I followed a little bit. I haven't got on your Facebook to like it yet, but glad to have that info. At one time, part of that process was to look at getting some entrepreneur backers, I want to say. Those folks who would be interested in creating a business here with financial interest, whether it's equity or whether it's stock, or whether it's a loan that can turn into equity, or whatever. I know that you've had a lot of things going on in 5 months, Jackson, and you and Dave, but I think that is that still under consideration?
It is. So the organization has a little bit of capital available for that through what is called the Quest Ventures Fund, which is from an old partnership. You're familiar with that, Ron. And that's sort of waiting to be leveraged, those funds, but those can be invested in a business that doesn't have to be in the form of a loan. And I have written on my whiteboard in my office something along like a entrepreneur capital fund group or something like that. So I think that is a possibility, but not something that outside of the funds that we have that could be leveraged in that way. There's not an existing group for that.
So really you need a company that is interested in that part, and then there might be some potential. Is that?
I think that's right. I think the idea is to build the connections to and make sure that, if you're a member of this community who thinks that you might want to invest in something like that, then I think it would be good to get plugged into what we're doing. And then as people come along, if someone comes in and they've got a great idea, but they're going to need some venture capital money in order to get it off the ground, then we want to be able to connect those people to those sources of capital.
That's all I have.
Okay, couple comments, Jackson, and thank you for your presentation today. A lot of your comments are a design that Startup Hutch is new, and yes, the current approach is new, but the Quest Center has been there for 30 years, Ron?
1984 or 87.
Okay. And this is an ongoing process of Quest Center and a new approach towards that. So I guess I don't want us to just say we're going to work on these new things. I hope that we're continuing to work on what's been done in the past. And then my second comment is that you say that you're working with a group to put together measurement tools. I think from my standpoint at the county is that we've allocated some money to this approach for a period of time, but we're going to have some, just as we were talking to the health department, we got to have some kind of measurement of whether the county money is being used towards a positive end.
Mm-hmm.
And I know it's hard to measure, but we've got to have a measurement. And so in your future endeavors, please try to create that tool so that we can work on seeing whether we're actually accomplishing the goal that was put together by the city, the county, and the community foundation on this fairly large allocation of monies.
Yeah,
Absolutely.
I might add along with this, to get your word out a little bit more, is just as a consideration, instead of being able to go out in all the communities, spending that time and that money it takes to travel, you know, we've got some weekly newspapers around that are sure looking for things to help their communities, as well as an opportunity to put up some posters, to talk with mayors out there. You don't have to go out there every month like I used to do, but spend some time getting that known out, because Startup Hutch is a really startup Reno County, and so I think that would be certainly beneficial, and that would help get some of that.
A point well made.
Yes, I agree.
Okay. Thank you, Jackson,
Right.
for being here.
Thank you both.
Okay, moving on to business items. Is Renee available for item A? Is she outside? Randy, how do you want to handle commission holiday 2021 schedule?
If she's not here, move it behind Mark.
Okay, we'll go on to planning commission issues. Mark, planning case 2020-06. Give us your condensed version of this, please.
Okay, good morning, Commissioners. Mark Von
Mark,
Atchen.
condensed version's not very short.
And I did set in on the on
You-
part
you've
of
heard
that
this,
on the
okay.
commission, on the planning commission. So
I'll do my best, Commissioner. Mark Von Atchen, County Planner. First case is a request to expand an existing business by constructing a 100 by 200 foot building on a previously issued conditional use permit in 2018. Really, the only reason why we are before you today is the fact that this additional building was not put on that site plan in 2018. If it had been, then we could have looked at the entire development and approved that and issued a zoning permit, but the owner's business is growing rapidly. He didn't anticipate needing an additional building this quick, so we're before you today to seek approval of that. Access to the property is by a private road easement. This building has been relocated from its original location due to some concerns with the possibility of installing an additional septic system, and the owner has decided not to do that. And instead, he's going to locate that building behind the existing one. The building requires 40 parking spaces, and the owner has requested a waiver of that requirement. The regulations also require that he permanently pave the driveway, and the owner has requested a waiver of that. And I'm here to tell you that both of those waivers were granted in 2018 by the county commissioners. Due to the amount of gravel on the property, staff had some concerns with the drainage on that property, and the owner, in talking with him, has agreed to not put gravel on 40 feet of that parking area to the west property line, and so that's going to help with the natural drainage and not have gravel in that area. 3 loading spaces are also required, and the owner has requested a waiver of that requirement, as well as the screening requirement, which is required due to the fact that there's a residence to the west of this building. And so there are 4 waivers under your consideration for today. All planning cases must be consider the factors. They're listed below in your report here. I won't go over them unless the commissioners have specific questions on any of them. With that, staff recommend approval of this request based on the 9 factors, and there are 6 conditions for your consideration. August 20th, the Planning Commission did review this case and conduct a public hearing, and the Planning Commission recommended approval of the request by a 7-0 vote. They also granted the waivers for the parking, paving, loading, and screening requirements. So with that, I'd be happy to answer any questions.
My only comment is I've been pleased with how his initial project looks at that location. There's some yard there that looked very attractive, and to me, it's a real asset to the Yoder Road area, and I'm sure that this next part will look as good as the first part, so I have no problem with this.
Quite a building. I would move to approve planning case 2020-06, a request by Yoder 5 LLC, applicant Mark Nisley and Yoder Metal for a conditional use permit to expand an existing metal roofing production facility at 9611 South Yoder, based upon the 9 factors and 6 conditions that is recommended by the Planning Commission.
I second that. Is there any further discussion? If not, please call the roll.
Commissioner Hurst.
Yes.
Commissioner Sellers.
Yes. Next case, Mark, is planning case 2020-07.
This is a request to expand an existing storage facility by creating 10 12-foot by 30-foot storage stalls, which will be outdoor storage, and then constructing 2 16 by 72-foot additions onto the existing storage building. This development will occur in 2 phases. The first phase will be demolishing the existing bait shop building. There's an existing dilapidated structure out there, and the owner is going to tear that down. Also, they're going to construct 1 16-foot by 72-foot addition onto the building. They're going to install the perimeter fencing, install the automatic gate and keypad, adjust the cameras and everything to capture that outside storage area, and then they're going to install some dusted-on lighting. After that's all development and the owner gets some additional capital, then phase 2 is going to be involved in constructing an additional 16 by 72-foot addition. He's going to reduce the outside storage area from 10 down to 5, and then he's going to add some additional exterior lighting and security cameras. One of the biggest concerns we had with this in looking at this site plan was the setbacks. Setbacks are going to be 8 foot from the north property line, 30 foot from Willison Road and Boundary Road, and then 15 feet from Westview Lane. The reason this is a concern is because looking at his site plan, the owner has about 5 feet of space to spare to be able to comply with the setbacks, and so the owner needs to be extremely careful that he does not exceed those setback requirements. But in looking at it, it does comply with the setback requirements. As far as the fencing goes, Public Works has looked at the fence location. That's all that we're really concerned about is the avoidance of site triangle issues. Public Works has looked at that, and the type of fence and location of the fence has been approved by Public Works, so there's no concerns on the fencing. Again, factors are listed below in my report that you shall consider when making a decision with this case. Again, I won't go over those unless you have specific questions on my report. So staff recommended approval of this request as well based on the 10 factors that you see listed in the report, and I attached 9 conditions of approval. Probably go over just a few of them here just to kind of explain that a little bit further. Number 3 was no general public sales are permitted from the storage facility. No business activities other than specified in the plan of operation may be conducted from the storage facility. However, the sale of items within a specific storage unit or units by the owner due to noncompliance with the lease agreement is permitted activity on the property. So we don't want people out there renting a storage unit and then just conducting garage sale. However, we want to have the owner the ability to sell the contents of a storage unit should it be defaulted for non-compliance of the lease agreement. So that's what that condition is about. Number 4 is the outside storage of items is permitted only within identified outside storage units. We don't want to have RVs or boats being just thrown all over the property there. It is a smaller property. It is a residential subdivision. It just so happens that, this is a commercial lot within that subdivision, so we want to have everything contained within those outside storage units. The fifth is the intentional routing of water used to wash items stored at the facility into the township or county road right-of-way is prohibited. You're not allowed to drain water intentionally into the county or township ditch. That kind of leads me into the Planning Commission discussion here on August 20th. We had the public hearing on this, and really the biggest concern was that existing well. There's an existing well out there, and whether that person would like to use that for potable water, for drinking water, or to be able to use it to wash boats and RVs off. He's had some requests by people to do that, and so Darcy Basie from the Health Department was available at that meeting to kind of explain the process that the owner has to do if he wants to be able to have the ability to wash boats and RVs, or be able to use that well out there for drinking water. And so there is a condition on here that says that he should contact KDHE for those requirements. With that, the Planning Commission did not really have any concerns with this request either, and so they recommended approval by a 7-0 vote. Questions?
Mark, you mentioned a couple of times in your presentation security cameras. Is that a condition of our codes at all?
No, we don't have anything.
He's just planning on having.
Yep, he's just planning out.
Okay.
We don't have anything in our regulations that require security cameras
Okay.
or lighting.
Okay. Commissioner Hurst, any questions?
No, I have none.
Okay, is there a motion to accept this
I
or
would move-
reject it?
Yeah, I would move to approve the planning case 2020-07, a request by Cheney Lake Storage LLC, applicant Jason Robin for a conditional use permit to expand an existing storage facility at 8812 East Boundary Road and 25311 South Willison Road, with the 10 factors and 9 conditions as presented by staff.
Okay, I'll second that. And before the vote, I'd like to thank Mark for his thorough presentations of these. I think he does a very good job of taking the planning case and making sure that the additions that we need to look at are included in the recommendation.
I have a very good discussion on both of these items by the commission.
Okay. Please call the roll.
Commissioner Hurst,
Yes.
Commissioner Sellers,
Yes. Okay, thank you, Mark.
Thank
for
you,
being here.
Commissioners.
We'll go back to item 9A, holiday schedule for 2021 by Human Relations Director Renee Harris, please.
Good morning. Sorry, I apologize. I was on the phone. I thought it wouldn't take that long, and it did. So this is regarding placement of the Commissioner's holiday for 2021. I know I tried to put as much detail as I could on there. I know we had it, both of you, I think we were here last year when it was set. Or maybe Commissioner Hurst wasn't, sorry, or Sellers. I'm sorry, I've got lost track of who came in when. But anyway, do you have any, you want me to go through this a little bit more? Does that make sense?
I don't. Are you asking?
No, it makes sense.
I would just ask that your schedule has been approved by the county administrator.
Yeah, we did have discussion on it.
Okay.
And the department heads as well.
Okay. Is there a motion to approve the holiday schedule for 2021?
I would move to approve the commission holiday schedule for 2021.
Second. Any further discussion?
Glad to have an extra day off for my birthday.
Well, we placed it correct.
Please call the roll.
Commissioner Hurst,
Yes.
Commissioner Sellers,
Yes. Okay, thank you,
Okay,
Renee,
thank
for being
you.
here to present that.
If I could just get my wife to go along with that extra day, we'd be
Extra
okay,
day.
wouldn't we?
Well, whatever. Moving on to item 10, County Administrator Report. Mr. Partington, do you have items today for the commission?
Yes, I have a couple items. I let you kind of briefed you on KDHE, the Kansas Department of Health and Environment, made a request last week about whether Reno County with our certified water operator would be willing to help Western Acres Mobile Home Park, and this is just one of the options KDHE is looking at. So they have requested to see if Reno County would be willing to help. In talking with Don and I called KDHE. Don's concerned that we only have one person right now. They say it's only a few hours a week, but Don's concern and mine is, how long will this be? Is this for a year, 6 months? And with only one on staff, it kind of stretches our staff member. We could do it if the county commission really wants us to. If not, we'd probably let them know that we just don't have the manpower at this time. We could make it work if you guys wanted to. It's just not the ideal situation.
Any comments, Ron? I'm comfortable with the county administrator's position that it's not our job to do that.
It is not our job. We're short on manpower, and I think between Public Works Director and Randy, they've made a correct decision.
Okay.
I'm fine with that.
Okay, we agree with you.
Okay.
Oops, sorry. This is my turn.
And then just a reminder that Thursday, September 17th is a public hearing for the wind energy regulations at the Kansas State Fairgrounds Encampment Building. The auditorium in that building is where that will be, so we'll hold more than enough people. Just kind of reminder, and then also to let you guys know publicly that Mary Lynn Baker has resigned effective immediately last week from the Planning Commission. And it's our recommendation that you don't put someone on or appoint someone at this exact time in the middle of all the wind energy and public hearings that's going on. It'd be tough for them to learn that quick and be able to make a good informed decision.
I agree with that. Would you indicate what place? I know our planning commission has certain delegates from certain areas that represent various areas of the county. What position was she in?
My understanding of this is that she was in Commissioner Sellers' area. I don't know exact specific, but overall in your district.
Okay, Ron, you kind of keep track of those. Is that a city position? Or?
I didn't look.
Okay. Assuming
take-
that it is, okay.
I'll take administrator's word on that.
Okay, I agree with the county administrator that would not be appropriate to appoint a new person to the planning commission until after their review of the wind energy regulations. I just don't see how anybody could get up to speed on what others have worked 2 years on.
Yeah.
I would say in regard to that, and then we'll go back to Randy, is that if there's anyone listening today in the county that is interested in that position, if they would call me and tell me why they're interested, it might be good to start looking for someone for that position. Randy, other items?
That is all I had.
Okay. Commissioner Hurst, do you have items today?
No, I think I'll wait till we get into the other last discussion.
Okay. I wanted to acknowledge an article that I saw in the newspaper this past week on crime rate being lower in both Hutchinson and Reno County. I guess I'd like to request a sheriff or somebody from his office to come to us in the near future and better give us the information regarding those figures. I think it's great that the report shows that crime is down, but I'd like to understand that report a little better than just the newspaper, please.
I did forget one thing, Commissioner Sellers.
Okay,
You're
just
done?
a second. Randy, would you, from time to time this year, I've asked for an update on where we stand with the 2020 budget for the end of the year. Looking on this here in the next couple weeks, would you give us another update on that? I think it's interesting to know where we are on that budget and where you feel like we're going to end the year. I did hear just this weekend the first part of the marketing of the county has approved. I think it sounds good to me. It sounds like that we're just informing the public of what our concerns are, and look forward to additional things regarding that. My final item is, has there been any process, Randy? 2 weeks ago you suggested that we needed to rent more space for the health department. Since that time last week, you indicated that you felt by working with the co-directors of the health department that we could move some people so that was not needed at this point in time. Is that your current position?
At this current time, yes. And working with Megan on this, her thought was we probably could have some remote workers instead of renting space and then having the health department have to find the rent money plus utilities for a year that CARES Act money won't cover.
Sure.
Yeah, so at this time, we're looking at having people work remotely.
Okay, I think that's an excellent idea that you and the health department is looking into. I just, and I'm sure you will, those people that we ask to work remote, we need to verify that we're getting the same quality and efficiency of work from that remote workforce that we would have if they were present. We don't want to delete any of the items that the health department are currently providing. Okay, and you said you had an item to bring
It goes
up.
right along with one item that you briefly brought up, and that's the marketing plan. That I would really compliment Dr. Degner on his episode 1 of his story that appeared on the Hutch Post. It explained a lot of things in plain old common words that people could understand. And so I just wanted to give that compliment to go along with what you said, that Dr. Degner did an excellent job, I thought.
I agree, Commissioner Hurst, that was a good post. It's interesting to me that we've been bombarded with pros and cons, and you know, it's like so many things else we face in this world. We don't know what the truth is. I thought he did a very good job, like you say, of putting it in common words for us to better understand. Other items? If not, we'll move on to a discussion with Interim Health Officer Karen Hammersmith. Randy, you want to introduce this, and then we'll have the ladies visit?
Yes, this discussion item was to kind of the health officer in general with Karen, how things are going, but more specifically as the governor's health order is possibly coming to an end, and we don't know the status, if the legislature is going to let that continue. We thought that before Reno County is ready to make a decision on a health order or, continuing mask mandates or anything, that'd be good just to have a discussion with Karen and Adam. I think he may also come in. So that's kind of the item. We also have, going back to the Bowercom, the media, Megan is here if you wanted a quick update on that item also. So.
Okay. Well, Randy, before you leave the podium, give us the background that I think we were told earlier today that the governor's deal might
next week.
Next
It's supposed to
Tuesday?
expire. It is on the.
At what time? What time next Tuesday?
That's what we were. Adam, do you
Sometime
remember?
at the end of the day next Tuesday.
I don't know that.
That's.
Adam, do you have I guess since we don't have another meeting until next Tuesday, maybe it has to have some importance as far as when that expires.
We've discussed it a couple times. We're not sure if it's 2359 on the 14th and it actually expires as soon as it hits the 15th, or if it's 2359 on the 15th. I think the important thing to talk about today is what it looks like when the governor's order expires, what the county wants to do to move forward, what their health officer wants to do to move forward, and just have a plan in place. I don't think it's imperative that an action gets made today, but maybe a plan to look at next week.
It's 2052, is it not?
It's 2052, that's correct.
2052, which was the statewide order. 2059 was directed at the schools. So by the legislature in passing House Bill 2016 approved the extension of the governor's emergency
emergency
declaration authority, from which the health orders then are issued, and they extended that until September 15th. I don't know whether it's 12:01 a.m. on that day or whether it's 12:01 a.m. on the 16th, but I suspect you ought to assume it's 12:01 on the 15th. There is a provision for, I think, the State Finance Council, composed of legislators, to meet and to further extend that authority beyond September 15th. And I've discussed this several times with Adam as to whether or not he's heard anything from the state as to whether there's any activity in that regard or consideration made to extend it, and we have no information that it will be. On the other hand, they could just, they just do it at the last minute. So the question is, there are a lot of requirements in 2052, rather extensive requirements, and if they go away on the 15th of September, the question is, the health officer would have the authority to issue an order, but that would have to be and needs to be in collaboration with the Board of Health, because under House Bill 2016, you'd have the right to nullify that order. So it's really a collaborative effort, again, even more so than it was before this amendment was passed, that if something's going forward, it'd be with a consensus of both you and the health officer. Would that be an accurate statement, Adam?
Yes, sir.
Okay, but just for a clarification of process here, the county health officer makes the proposal and dictates the what they suggest, and then it's the county commission's either to approve it or disapprove it.
Basically, yes.
Okay, understand. Karen, or whoever wants to speak next, please.
So we just needed to clarify. I would propose that we would go ahead and make a mask order if the governor's order does run out. If they go ahead and renew it, then we're following the governor's order. We are not following a Reno County order right now, and that's what Adam is clarifying. That when the governor's order runs out, we do not have an order. Now, if she renews that, we would still be following her order. But I would propose that we would go ahead and do a mask mandate, the same as what the governor has had in place.
Any other factors, Karen, spacing, and the other issues addressed in 2052?
They really just address the mask mandate in the community that was in buildings. It does address that, under 5, they don't necessarily have to have them, or if you have a disability. And that's kind of written out. It doesn't have the social distancing in there. Those are all guides. Washing hands, social distancing, those are specific guides.
Okay. Comments, Commissioner Hurst? Guidance? We've heard what Karen is going to suggest. If the governor's regulation continues, or if it doesn't, we've heard her items that she would suggest. And as I understand it from what Joe just said, based on that, next week we would, the county commission would have the option of negating that decision if it so was the intention of the commission.
Mm-hmm. I'd just like to go over a few things of what's happening out here in real life, if you don't mind. As far as students, they're driving to school. They congregate They either in the parking lot or in front of the school before they can get in. They're not wearing masks. They walk into the school. They put their masks on. They go into a class to where the desks are set up social distancing. Some teachers say, no, you can't take your mask off. Some say, yes, we're social distancing. We can take our masks off. There just seems to be a lot of confusion out there that's adding extra things to these kids to handle. They want to come home and ask their dad, hey, how come we get this? How come this? Or they're asking mom. I just question some of the things that we're trying to over regulate. For instance, they go to lunch. Let's just say every other seat is X'd off, okay, which is probably what's happening a lot of them. They're closer than 6 foot. They take off their masks, they eat, they converse, they talk at lunchtime. So it's just a lot of confusion out there, and not only that, but we're saying one thing and we're doing something else. It's just like what happened with sports. You got a football team out here, and maybe you can have 2 tickets for each participant, plus the band, plus the cheerleaders. You go to a soccer game, maybe you have 150 or 175 people in the stands for a football game. That's okay. You go to a soccer game, you got 2 tickets per participant. Maybe you've only got 30 sitting in those stands. Why one and why the other? You know, they can still have social distancing. They can still do the thing. And I realize this is probably not commission, but I just wanted to reflect upon some of the disparities out there with regarding these plans that are in effect. And just wanted to bring that out. So I think people need to understand that it's not quite all even, or it's just hard to make sense of some of these things that are put out there as regulations from CASA as well as the school board. So just wanted to make a comment on that.
Ron, I understand the comments you're making, and I think they're very sound comments that you're making. But as I listen to them, almost all of your comments relate to what a school board has decided. And we learned a month ago that those are school board decisions.
But CASA is not. Kansas State Athletic Association, they made those regulations regarding.
But the school board is either accepting those or decreasing those. They have the ability, and then Joe, help me here because I don't pretend to be a legal person, but our individual school boards have the ability to accept those, decrease them, strengthen them, be wherever they want to be. Isn't that what we've decided?
I think that's correct. That's what the Attorney General's opinion reflected.
Is that, I think, and we were all confused. We thought a month ago that the county commission had a input
Yes.
into this, and we had this really intense discussion, and then a day later we found out that the Attorney General
nothing
said
to do with it.
that those are school board decisions. And I understand what you're saying about, I went to a football game yesterday at Gown Stadium. Gown Stadium seats 9,000. I don't know, a lot of people. Obviously everybody could go that wanted to go, and there was still the ability to be apart, and you had a 30-mile wind, and I think it was a safe situation. But I think the things that you're bringing up is that we've got to tell our citizens that those are things to be addressed by their school boards on how they suggest that they want it done within their community. And I kind of feel, and you made this point a month ago, Pretty Prairie and Fairfield are a little
They're
different.
all different.
And the more students you have in a condensed area, those school boards have got to take the bull by the horn and tell their citizens what they're going to do and keep us out of those issues.
That's good. They need to tell the superintendents and the teachers, this is what we're going to do.
I think maybe they've been a little not willing to be as suggestive as they need to be at times,
Good word.
or open as they need to be.
That was good, except the city of Manhattan put the kibosh on how many can come to the K-State games.
Mhm.
I'll say that.
Okay.
But anyway, that's
Okay. Okay, so I think what I'm hearing is we'll see next week how this filters out from your recommendation.
Too, would like to see how you coming along on that grant for community testing.
Megan
And,
can speak to that.
Yeah.
And then, Megan, do you want to make any comments on our marketing program that was brought up? You might want to talk about that, please.
Good morning, Commissioners. Megan Gottschalk, Interim Co-Health Director. Yes, the grant funding, I'll elaborate about that. We did submit some grant funding to KDHE, which we should know about hopefully by the end of this week or by next week. So as we know information, we will continually update you about what that status is. The marketing firm with Bauer, or the marketing campaign, public health marketing campaign with BauerCom, wanted to give you a quick update. You mentioned earlier today that you heard Dr. Degner on the radio this weekend, so that was the first thing. BauerCom has 5 points in which they have created their marketing campaign around. The first one is what you heard about is personal stories, being kicked off with Eagle Media, and I believe they're going to reach out to Ad Astra per Aspera to continue on with some of those that information. It's called My COVID-19 Stories. So Dr. Degner kicked it off this past Saturday, and then they will feature personal stories from individuals in our community who have had COVID-19 and who would like to share their story. So they're getting those individuals from physicians who will be willing to visit with their clients or their patients to see if they'd be willing to share. Or if there are people out there in the community who would like to share their personal story, they can contact me at the health department, and I can connect them with Lori Bauer, and then they can organize that story to go live. The second piece is organization of a healthcare collaborative, which is more merely a social media campaign. So they're asking our healthcare collaborative partners to look at individuals within their organizations to share social media posts. And those social media posts can be shared on Facebook, Twitter, any other social media platform. And then once they'll be labeled with like a hashtag healthcare collaborative or whatever BauerCom decides that needs to be, there'll be some points assigned based upon information and what the actual post is. And the points will add up to Hutch bucks that will be purchased from the Hutch Chamber. The third piece is a mask advocacy piece. So you'll start seeing pictures of local individuals, possibly volleyball teams or daycare providers, talking about masks and what they do to protect us. So I'm wearing my mask to protect you, Ron. And so you'll be seeing...
What about this Ron?
Both of you,
okay.
both Rons. I'm wearing my mask to protect both the Rons.
Okay.
I think that stems back from working on the healthy initiative.
Well, they're good. We're accomplishing two things with one. And then you also might see like volleyball teams, we're wearing our masks so that we can have a season this year. So any individuals that want to be featured in that, they also can contact me and I can connect them with Lori and then they can organize that as well. The fourth piece of this is information sharing from the county, specifically from the Public Health Department. They're going to work with us about our website, putting information on our website so that it's a little bit easier to read and find specific pieces. Also about how we release information, the daily situation rep, and how we release public media campaign. And actually that phone call is going to happen this afternoon, so we're starting that today. And the last piece Barracom is hopeful to have is a physician update. One of our physicians from our collaborative, they are hoping that one of them would be willing to do some research updates about what's happening with COVID-19, the latest research, what's going on with an immunization and other information, long-term effects of it. So I think those are the things that are coming out. Those are the 5 pieces right now. I know that there will be more coming out. We've talked to Barracom a lot about what's going to be happening that's coming up in the fall. You know, we've got Halloween coming up and Thanksgiving and Christmas, and we know that families are going to want to gather. So we want Barracom to help us provide information that's safe for families to be together. Questions?
No, just a comment. I would work hard with them to make this easy to access. In my 2.5 years here at the commission, it seems like some of the stuff that the county puts out, you guys think it's easy for us citizens to access. I don't think it's quite as easy. So work hard to tell people how to get your information, please. And I'm not just speaking to the health side of it. You know, the other things are not as intuitive as I would like them to be, and so forth, and maybe they can help there too.
Well
Thank you.
noted. Absolutely.
Yeah, COVID, we're spending quite a bit of money, and it needs to be easy access and easy reading for the public, or it doesn't do any good.
Okay, thank you. I think, does that cover everything that you wanted to do in this discussion, Randy?
Yes, and just for the understanding to prepare in case the governor's order, well, when it expires, in case there's no expansion, you're looking for Karen to have a proposal for a health order, a county health order to be put in place and approved next Tuesday that would mandate
I
masks?
understand from what Joe explained, the process is the health officer creates the proposal.
Mhm.
The county commission then can override that proposal if they so choose. Joe, again, is that
That's
the problem?
generally correct. She issues if you can countermand the order, just like you could the governor's order, she might as well bring to you something that you consider worthy rather than just issue it. So it's her issuing authority and yours to countermand it if you so desire.
But the point I'm making is, she issues it, we can reject it.
Right.
Correct?
Yes, correct.
Okay. Okay, so does that complete that?
So you would like for her to bring something?
Certainly.
Right.
That's her position as interim county health officer to bring to us what she feels is appropriate. Right. She and her department. I don't want you to just speak for yourself. I want you to speak for your whole department. And Adam. Okay. Does anybody we have an executive session scheduled. Does anybody have the wording on this?
Commissioner Hurst, I've written this out here, and considering my penmanship, can I propose the motion? And if you agree, you would say so move or something to that effect?
I would handle that if that's okay with the
Sure.
council.
I would request that this board recess into executive session for 15 minutes for the purpose of conferring
Okay.
with the board's legal counsel
Thank you for coming.
on a privileged legal matter, that being the Pretty Prairie Wind LLC appeal